Hello, guys, it's another TGIF episode, and I welcome you to the Anti Pharmacist podcast. How's your week been so far? I know it's another end of the week, and you're looking forward to the weekend, right? Good. But as you go into the weekend, let me give you some education. Last week I started on the dangers of steroid abuse. So today we'll be continuing our discussion on the dangers of steroid abuse. But a little modification, guys. Since a lot has been said in the last episode, the foundation has already been laid. And I believe that part 2 and 3 can be accommodated on today's episode. So that's what I'll be discussing. I talked extensively last week on what steroids are and their functions in the body. The DEXA wahala has been taken care of. Now, let's address the toning wahala and the muscle wahala. First, the toning wahala. What people call toning these days is simply bleaching, guys. No need to sugarcoat it. People want to change their natural colors and become lighter for reasons best known to them. But a common one is that there's this belief that you're only beautiful when you have light skin. Black skinned girls are not that fine, which is not true. I know it's their skin and their choice, but at what cost? And is it really necessary? You were born black or brown, but suddenly you want to become lighter just to look more beautiful. You want to become Oyinbo when you were born in a black country. Now, wow. The disheartening thing is that some parents tone their children's skins and plunge these innocent kids into unnecessary health challenges, which may or may not manifest immediately. You see a black-skinned husband and wife come in with their child, who obviously looks like them, of course black or brown-skinned, but they want the child to be lighter. How now? That's against the law of genetics. It's not done that way. There are ways to take care of your skin or your child's skin that will make them look good and glow without having to change the skin color. That's part of what I'll be discussing with you today. So like I said in the previous TGIF episode, steroids are anti-inflammatory drugs, and using them when there is in fact no inflammation to combat has consequences. The dosage forms used for toning are the steroid creams. The common steroid creams are clobetasol, betamethasone, hydrocortisone. They have names that end in "vate", and I know that many of you know this. Others come as combination and triple action creams that contain antifungal and antibacterial medications. Some people use these creams as their normal body creams. Others mix them with the creams that they use. All in all, this is bad practice. These steroid creams are meant for treatment of inflammatory skin conditions like eczema, seborrheic dermatitis and other forms of dermatitis, acne, rosacea, and the likes. Of course, some clear scars and black spots too. But if you don't have these conditions, you don't have any business using them. If you're naturally light-skinned and you want to maintain your skin color, you should limit your exposure to sunlight. Eat healthy foods and use sunscreens on your body parts that are usually exposed. Better still, limit the exposure of your body. Wear clothes that cover your body. Use normal moisturizing creams and your color will be maintained. The essence of creaming the body is to prevent dryness of skin, which would make the skin rough. Moisturizers are best for this. They lock moisture in the skin and make it soft and shiny. For dark or brown skinned people, I thought that brown skinned girl was a movement. Or have you suddenly forgotten? Love your skin, and you don't need to be lighter to be beautiful. You're beautiful just the way you are. Use sunscreen as well if you don't want to be darker, because the dark pigment of the body, melanin, is caused by exposure to UV ray. Eat healthy foods. Give your skin the right treatment. Go to spas once in a while, or as often as you can afford. Use dermatologist approved creams, not ones claimed to be lightening or brightening. The reason for all this my talk is that using steroid creams to tone is harmful to your skin. The skin is the largest organ in the body and it has pores and layers. So think that it's only those that take these steroids orally that experience the side effects I talked about earlier. No, these creams are absorbed by the body over time, especially upon long-term use, and all the side effects I mentioned from abusing oral steroids, like Cushing syndrome, hormonal imbalances, abnormal distribution of fat, mood changes, also happen to people who use steroid creams to bleach. These creams remove melanin, which is a protective pigment from your skin. They also cause the skin to lose its elasticity, and then you start seeing stretch marks. Other direct effects on the skin are easy bruising, discoloration, where you have orange patches on the skin or some abnormal colors. You see some people, they have like 5-6 colors on their body. It even causes acne, different bumps on the body, and it can predispose you to cancer and kidney injury. Remember I mentioned about systemic effects, and kidney is the one that gets rid of all these foreign substances from the body. So those that abuse these creams may therefore experience kidney failure sooner or later and require dialysis to survive. You have been using these creams for long and you think it's too late to stop, Abby? Not at all. It's never too late to stop. Just switch to a moisturizing cream and let your body go back to its original color. Hopefully, not much damage has been done by now, but the error will be in continuing to use it even after you know the effects that it could have on you. Stop using this and you'll be glad you did later in the future. So also, be wary of the so-called skincare specialists who mix these creams and sell to you. All the effects I mentioned are not to scare you, by the way. It's just the plain truth. Most of these effects may not manifest quickly or now, especially in young people. It is in old age that they become more apparent. They become more obvious. That's what I have to say to you concerning using steroids as toning creams. A word they say is enough for the wise. I would recommend that you watch a documentary by Beverly Naya called Skin. It exposes the effects of toning and what it does to the skin. I think you will understand better. Let me quickly move to part 3, which is the last and final part. That is the muscle wahala. As we all know, going to the gym is now more popular than it used to be in the past. It's now in fashion, and many people go to the gym for various reasons. Some to lose weight, some to gain muscles. Some people go to reach particular body goals, others to socialize, and others to go for some other reasons that they know that is best known to them anyway. The use of steroids in muscle building is more common among men in Nigeria, especially the gym trainers, athletes, and fitness enthusiasts. Others are those people that want to appear macho, they want you to feel their presence. Others work as bouncers and they want to have this intimidating presence. And some are models, they want to show off their muscles when they are posing for those nice pictures. The steroids used for this purpose are called the anabolic steroids, and they are analogs of naturally produced hormone in the body called testosterone. This hormone is present in both males and females, but it is more concentrated and expressed in greater amount in males because it is responsible for the secondary sexual characteristic development in males. It plays a key role in the development of male reproductive tissues like testes and prostate, as well as increased muscle and bone mass and growth of body hair. It is also necessary for sperm development. It affects mood and cognition, sexual behavior, metabolism, and energy output. Testosterone is given externally for hormone replacement therapy in men with hypogonadism. That is the medical use of this drug. It is used in men with abnormally low level of testosterone, and it is available as pills, patches, and injections. Now, the injection form is the one that is abused worldwide by the categories of people I mentioned earlier, that is those that want to build muscles. In developed countries, it is actually illegal to use this drug to build muscles. Let me quickly talk about the side effects of abusing this medication. There are plenty, and these include acne, swelling, also called edema, that is buildup of water in different parts of the body. There's breast and enlargement called gynecomastia in men. Osteoporosis, that is brittle bones. Organ damage like liver injury and heart disease. Also, remember the feedback mechanism that I mentioned a few episodes earlier. If you have been following from my episode on birth control, you understand. But for the sake of those who haven't listened to that episode, let me explain again in terms of testosterone. You see, the production of hormones in the body is controlled by the pituitary gland, which is located in the hypothalamus of the brain. This gland is what triggers the site of production of various hormones to release them by itself, releasing some chemicals. In case of testosterone, which is produced by the testes, when the level of testosterone is high, the brain sends signal to the pituitary gland to reduce production. This is called the negative feedback mechanism. Continuous use of testosterone injection to build muscles causes the negative feedback mechanism to be activated, and after a while, production of testosterone is stopped altogether. Now, this testosterone used for muscle building is at higher dose than the testosterone used for hormone replacement therapy, and it is injected directly to the muscles. These hormones also have levels and a range. The level required to perform all of the normal functions as listed earlier cannot be achieved by using testosterone injection to build muscles. Besides, you are injecting the muscle directly, so that's where it acts, but the body recognizes that this hormone is present in the body anyway. Other parts that need it are deprived since it is no longer produced. This is the reason for the side effects you begin to experience, like low sperm count, which leads to infertility, shrinking testes, decreased libido, impotence, and increased risk of prostate cancer, which starts with prostate enlargement and difficulty urinating. Balding and receding hairline is also common amongst men that abuse testosterone. A paradoxical effect known as muscle wasting also occurs. After I have told you all these bad things that happen to your body when you abuse testosterone, I think it's only fair to give you healthy alternatives to building your muscles. The truth is, most people know these things, it's just that they want to take shortcuts. They want results fast. Well, some actually plan to use this testosterone, this anabolic steroid for a while, and after they have built the muscle to an extent, they will stop. But these things cannot be stopped that way. They can be addictive, and you even find yourself unable to stop because stopping suddenly adds some unpleasant effect called withdrawal symptoms. So you would rather continue using them, and before you know, the best way to build your muscles is the straight and narrow, which is the good old exercise. By exercising regularly and consistently, your muscles are sure to bulge. I know it's not easy, but it's you that want big muscle now. You should know it's not easy to look macho with muscles everywhere. Anyways, that's on a lighter note. Truth be told, it gets easier as you keep going. When you keep doing it consistently, you see the results and you will be motivated to keep going. There is a principle called progressive overload, in which you will see obvious improvement in muscle growth by increasing the time, weight, or intensity of exercise by 10% each week. Your gym trainer should be able to help you with this. Just talk to them about your muscle goals, and they should be able to recommend the right exercise regimens for you. Besides, there are protein shakes and supplements like whey protein powder, which are legal and readily available for you to buy and use. You can also consume high-protein diets like beef, eggs, dairy milk. There are many of them. You know that the DNA is the basic unit of life, and it is what forms the cells that forms these muscles that you want so much. Protein is the basic thing that you need to consume lots of. Coupled with exercise, you'll see the results in no time. Ask Arnold Schwarzenegger, The Rock, or Hugh Jackman how they build their muscles. Most of them are placed on strict diets in which they count their carbs, and this is done by their nutritionist in order for them to fit into their roles or to meet their bodybuilding goals. Hugh Jackman did not just become Wolverine overnight. It was on this strict diet that I talked about. I read a recent interview of Arnold Schwarzenegger on how he built up his muscles when he was still young in the 70s as Mr. Olympia. What he had to say was that what he used was diet, consistent exercise, and the progressive overload principle that I mentioned earlier. Even now at 76, he says that he works out every day. So your muscle building goal is not far-fetched. You just have to put in the work. Before you know it, you have those muscles feeling everywhere and you'll be happy. And that brings me to the end of this episode and the series on dangers of steroid abuse. I've tried my best to educate you on the effects of abnormal use of this class of drugs and the healthy alternatives to obtain the same results. You don't have to use steroids to gain weight. Neither do you have to use them to tone your skin or to build muscles. There are very natural and healthy ways to do that. This is what you should stick to in order for you to live a healthy life and for you not to come down with diseases that will make you regret. I hope with these few points of mine, I have been able to convince you and not confuse you that steroids are not to be used for weight gain, skin toning, or muscle building. I hope you take my advice for your own good and for your health and general well-being, especially in old age. Garbage in, garbage out. That's how the body operates. It's what you feed it that determines how it serves you and how it reacts. Do not abuse your body by feeding it garbage. As always, your comments and questions are welcome. Please do well to share, like, follow, and subscribe to this podcast. Also, you can now follow on Instagram at Antipharmacist Podcast, and you can reach me via mail at antipharmacistpodcast@gmail.com. We are open to your collaborations, suggestions, and anything you might have to say at all. Special shout out to those who have followed the podcast on Instagram and those who have been listening to each and every episode since inception. I see you guys and you are highly appreciated. Till next time, stay healthy and God bless you.